Am I live?
You're live.
Jules, come here.
Oh, okay.
Jules is in the house. So we're coming. This is session number 2 of Facebook Live. And we had an overwhelmingly positive response for the first one. So it's actually encouraging me. My crazy staff is here making faces and everything else. So individuals out there, I want to welcome you, and for those who are tuning in for the first time, I want to welcome you also to Michigan Sports and Spine. I am Dr. Pierce, and we are trying to communicate with our patients with all this telemedicine and everything else. We're missing being able to touch and feel everybody, but this has been a fun exercise that my staff set up, and I agree that we had some fun with it last week. We've got a lot more questions this week. A lot more people are getting involved. We're actually passing the word. So what we can do, number one, is it is on Facebook. If you can encourage people to watch it, I'm trying to be very informative. For those of you that used to watch our radio show on 97.1, we're going to start trying to move towards that version. We're trying to work on getting the band back together. So if we continue to get positive reinforcement that this is helpful, I think we are going to go a little bit longer and more of our radio show format, where we were able to take topics every week, take on charities every week, take on ideas about regenerative medicine and topics of the week. And without sports being going on right now, or at least in a limited fashion, I think there's actually a sports question too for me today. So just jumping right into it, and I hope everybody loves the color that I'm wearing today, because my staff said I need to be real bright and cheery today. And fortunately the sun's shining, so we're a little bit happier. So question 1 is, hi Dr. Pearson team, I was just wondering what safety processes and procedures are in place to ensure that all the exam rooms are clean and sanitized between patients, and that comes from Miss Moore. Pretty much, I mean, we're like everybody else. There's no cutting corners with this, because everybody's worried. It's funny, one of my last patients that was here just talked about Ford Motor Company, that they've had an issue already, and they're already thinking about having to close down again. We're taking all the precautions necessary. So it's all the CDC guidelines that we're following with a little bit more. We're making sure everybody gets tested at the door with temperatures, and a questionnaire that pretty much will take on, are you having any symptoms? Have you had symptoms? Have you traveled? If you're going anywhere right now, you pretty much expected to fill out one of these. The rooms and chairs are being sanitized before and after. People are not sitting in the waiting room. We're actually using the car as the waiting room, and we're calling you in. Each room is being sanitized after. Even the hammer that I use for reflexes is being cleaned after every patient. And everybody's wearing masks, including myself, which I'm telling you is not the best thing, but it's because I read people's faces a lot, especially with discomfort, and it's hard for me to do that. So it's a lot more verbal contact, a little bit more questioning, but I've definitely favored my career after reading people's body languages, and it's really, with a mask on, it's much harder. So yes, feel comfortable that we are seeing patients in the office. We are prioritizing with emergency only. We're still doing telemedicine on a majority of our patients, but right now we're bringing everybody in that has emergent problems, that needs injections, that needs pain control, and needs an evaluation. So we're seeing new patients, number 1. Number 2, we are seeing patients with new issues, and we feel a little bit more comfortable with them. But again, we have to trust the patient also that they're giving us good information. There's talk about rapid testing being done. That's being done in the hospitals right now. We don't feel we need to bring that here right now, because we have nothing emergent that we need to bring you in if you are questionably sick. If you are, then we can set up other measures for you directly through our system. But right now, we're not bringing anybody in that's symptomatic. So you should all feel comfortable with our system and what we've set up. And if there's suggestions of how we can do better, you can also let us know. So the next question comes from another patient saying, my back pain and leg pain, again, I have already taken the 3 shots, but when the virus hit, all my treatment and physical therapy had to stop. What is my next steps to do? So actually, this is one of the most important questions that's been coming, because we've spent so much time and we vested, like if anybody has already seen me or is going to see me, we're talking about my 6 to 8 week program, which is the commitment to injections, it's commitment to therapy 3 times a week, it's committed to home exercises every day, if not 3 times a day, and now my whole new thing with the yoga and the Pilates and flexibility. So with anybody that's been treating with me for a while, or anybody who's new, I feel the coordinated program is very important. So yes, the injections were important, but the coordinated system after is difficult. So fortunately right now, our therapy is open. Most therapies that we deal with that are on my approved practice are back open. Everybody's using CDC Guidelines. It's pretty much one-on-one right now, which in some ways is better for you because you're getting direct care from just the therapist for that whole hour. There's no more going on the machines and doing stuff like that and then go treat somebody else, because there's only one person per provider. So in some ways that's actually a big benefit. So for this person, yes, our physical therapy is open, so that would be your next step. Getting onto the yoga. If anyone who's been watching or following our emails or our Facebook or any of our tips, we're pushing for yoga for beginners. Why? Because a lot of people have been making fun of me because my daughter got me into yoga, and to be honest, I'm doing it, they say, 5 times a week, which is pretty accurate. I'm doing something 5 to 7 times a week between core exercises and yoga. And some patients are going to say right now, well, you're telling me to do it twice a day. And yes, I am telling you to do it twice a day, because you should be doing the yoga in the morning. And if you've gotten through where yoga is not so bad, you're doing the core program in the afternoon. And if you truly follow my new script of life is meditation before you go to sleep. So, and to be honest, I've put it out with a little bit of a sarcastic tone, and a lot of patients are actually following it, and they're telling me, it's really helping. I'm getting a lot of positive feedback from the patients. And in our underlying philosophy, don't forget, is always non-surgical, non-narcotic. So this whole COVID thing, we've from day one, from the first time I've put messages out, I said we need to spin this in a positive way. And to be honest, that may be our positive way, because I think people are starting to find out there are other things you can do besides going and just, I don't want to say be weak with taking medications, but sometimes going for the opioids or the narcotics is first run is, now that you don't have to rush out to work, or you don't have to rush out to go do something, you're able to take the time to actually do, if we call it yoga, and I'm using that more of a general term, but it's more for finding your flexibility. If it's through Pilates, if it's through, Faith has been really good about getting exercises out to everyone. People are doing face exercises, they're doing our home exercises, but some program that you can relate to. And again, I'm not here to force my program on you. I'm here to force you to do something. I'm here to force what you are relating to. Meaning, if you don't like yoga, and I've had guys who've said, Doc, I'm not doing yoga. I'm just not doing it. I need to still get through to them that you need to do something to get off of first base. Okay, if I never get the flexibility back, it doesn't matter how many injections I give you to stop the pain, the recurrence is very high probability. So when I inject, so the whole theory of injecting is to calm the nerve down, calm the muscles down, and let the therapist expand. Because if you don't release that muscle around the nerve that's irritated, and the nerve gets re-irritated because the muscle kind of grabs it again, you've pretty much wasted time, money, and your overall success rate. So it's really taking a step back of what you can do from multiple levels. And again, I push for non-surgical, non-narcotic, but again, it doesn't mean I'm not writing any narcotics. We are doing it, and it's not a long-term plan. Like when I get a new patient who's like, I've been on, Norco for 10 years, I've been taking 4 to 6 a day, and that's just great, and they come in and saying they're 8 out of 10 pain. What plan is that? That's not a plan. First of all, I'm not sure if it's working, not sure if I'm actually enabling them, meaning that they're willing to go to a pill than to do the exercise or the stretches or go through the discomfort before they do a medication. It is okay in a small period of time, And I will tell you, I have patients that are on it for years, but in moderation and in understanding. So our goal is to get you through that discomfort, that discomfort with the medication, not become dependent on it. So that's a big point right there. We're using medications to get you through a period of time, not become dependent on it. So we have a lot of other options. And we're looking at the yoga, we're looking at the acupuncture, we're looking at the meditation even. If you read books and you read some of these other doctors, they believe that pain is a state of mind. And I can argue both ways with that. But the point is I have to deal with the patient who's in front of me. And if it is their part of mind, or if there is their way of thinking, we still have to conquer that before we become successful. So that, again, there's a strong philosophy here. I just had a patient actually, I don't know if I can even say this. Don't say it. I was told not to say it. Just in summary, I had a patient who didn't understand our philosophy and felt her needs were stronger than my philosophy. And the goal was, the short of it is I will not hand out a medication just because you ask for it. I will explore what I say in the box medicine, which is the classic medicine, but good doctors and between a good doctor to a great doctor is the one who knows all the medicine within the box. But when someone falls outside that box, you got to have a doctor that can adapt to that and figure out other ways to solve the problem, other than here's another medication. And 9 times out of 10, you're not going to hear that from me, that here's another medication. This is what we need to do. Classically, and my team makes fun of me, I'll say, you're going to hate me for 6 months, but hopefully give me a hug at the end of 6 months if you'll go through the program that we're outlining. So, enough of that. So the next question, I think we're on question 4. You've been sending out a lot of yoga exercises. I'm able to do chair yoga, but not the others. You said you were able to do. Can you show us your favorite yoga pose or stretch? So I think someone actually thinks that's funny, and I guess we'll take that as a funny. But yeah, I mean, to be honest, some people have called me out that I'm not even doing yoga. But yes, I know what a downward dog is now. I know what's the other one?
You like the child's pose.
The child's pose, which I think is the best one, because to be honest, I'm not flexible in my back because of my back injury when I was 15 years old, which I didn't feel I got proper treatment looking back. So I have a chronic issue that I deal with on a daily basis. So I'm doing a lot of flexibility. To be honest, the child's pose, I'm more flexible at the hips because of that. So I'm able to get into that position a little bit easier. And it does stretch out and lengthens my spine, which is exactly what I need. But yeah, I've been able to get through the yoga, and I know what they're talking about. When they say the next pose will be this, I kind of have a mental picture of what that is. And I'm not falling over as much as I used to with the balance, because my strength and my core muscles and we call it small muscles of the body are getting better in tune to what we're doing. So yeah, I will show a favorite pose maybe later, not right now. How long are you, next question is, how long are you going to be doing telemedicine appointments? So this actually is coming up on a daily basis, because since we started, I've been saying, okay, we're going to see you in 2 weeks in the office, in 2 weeks, and then the governor, because of other issues that have come up, the 2 weeks has been extended and extended. So at this point, this past week has been the first week we're bringing patients in. We're going to be doing that every week on an emergency basis also. But the telemedicine is still proving to be a much safer way. I had one of our patients, Carla, who says she'll be listening today, but she's not comfortable right now. And I'm not here to push. I'm not here to convince you that it's safe. I think over time everybody's building a little bit more secure feelings about what's going on in our surroundings and the new normal, which is the big statement now. We should put that in our t-shirts, this is the new normal. But basically, she's not ready, and if you're not ready, then we're going to continue with telemedicine. Right now, the rumor is that it's going to be good through September. Insurance companies are continuing to pay for it. And as long as we can provide the care, and I'm making that judgment also, that if I feel I can still treat you and take care of your issues, which we've actually got a lot of testimonials that patients are appreciative that they're still able to have the telemedicine. We've been able to actively communicate with those individuals to keep them, one, secure, feeling safe, and that we're going to take care of their needs, that you don't need to run to the emergency room or the urgent cares or the hospitals, that we are being able to be very successful in caring for the individuals over telemedicine. Like I said, I mean, it happened on Monday. I have someone with his shoulder where they can't lift their shoulder, and I said, okay, come in tomorrow. And we got him in, got his shoulder, injected, evaluated to make sure that nothing serious was wrong as far as a more complete tear, and we were able to treat him successfully. And when he left the office, he felt great, but hopefully, in my mind, he's going to continue to improve on that. So, next question. This is a little bit lengthy. I don't have to do it?
They went through a series of injections and didn't really.
Okay, so basically it says I have another appointment at this time. However, I have a question. I've had extreme pain in my left arm and left side of my neck with occasional headaches. I also noticed that the steroids is making my face and upper body heavy and seems not going away. It's almost been a year from the epidural. So basically, when you do have side effects from the steroids, it's usually a 7 to 14 day thing at most, if you're a reactor. So with this person, I would probably have to say I want to see them in the office to see what's going on. I don't feel it's related, and if it is, there's a rare disease that with your endocrine system that you're a reactor and it will sustain. But normal activity, you should be able to shed those pounds from steroids. And as far as what our other practices, we are working with chiropractors, with our physical therapists. Everybody's back open. I got a call from one of the chiropractors that we do a lot of work with. They're wearing face shields, they're wearing masks, because they do have to get up and manipulate the patient. And there's a lot of CDC secure there too. So if you're someone that is asking me, if you should still be seeing or go back to start seeing your therapist and your physical therapist, your chiropractor, yeah, I think now's the time. I think everybody, for the most part, is finding a way to reopen, kind of like us. I mean, I've had some doctors haven't skipped a beat. I have some doctors that, surgeons are having a harder time going back because of the surgeries. I've pretty much talked to all of our surgeons right now, and they're all back doing, like I said, more emergent, the ones that can't wait. The elective stuff is still being on hold, and unfortunately we're hearing that you're still not allowed to have loved ones in the hospital if you're over 21. So those have been concerns that we've been looking at. 1 minute.
Our surgery center's open.
Huh?
Our surgery center's opening.
Yeah, so our surgery center is open for essentials, and we're going to be starting procedures tomorrow. So everything's working for our office, and we're able to do a lot of what we need to do. And it's just taking a little bit longer, and I think our new normal is and we have a rhythm. We do still have a few road bumps that we're looking at, but everything is working out. At the end of the day, the patient's still being cared for, and we're still taking care of all the needs. It may be taking us a little bit longer. I think everybody, everywhere, is just learning to have a little bit more patience. And to make fun of myself, I know my waiting room, people have said this telemedicine is great. I don't have to be in that waiting room. But like one of our patients, Carla actually said this to me, that she totally understands when a doctor is being prolonged or delayed. It's usually because of a new patient or a newer patient has a deeper need, which is true. I don't follow a time that stops me. I follow that I've completed and answer all your questions. Typically, if you've seen me in person, the last thing I said, is there any more questions, or do you understand what I've explained to you? Because I've learned from a long time ago, it's not what I feel I'm saying, it's what I understand, what I want the patient to understand what I said. So it's the interpretation that I make sure is being understood, because it is a plan. And it comes from a lot of people, a lot of feedback, where you go home, all you heard was one word, and sometimes it was surgery. And if you say it early on that I'm here to try to prevent surgery, people's minds tend to shut down, or I'm going to do an injection, or I have a lot of athletes. I had one yesterday who had difficulty. He's a star basketball player, and he's been out since October, and he's coming to me. I'm his third or fourth opinion, coming from one of the doctor friends, and he couldn't hear what I was saying because I said you can't be 100%, and all he thought of was that I'm LeBron and I'm going to be 100%. Well, I had to explain to him that every athlete that I've dealt with and I deal with, and I deal with everyone who knows me, I deal at the highest level of performance, guys that are making millions of dollars a year. You don't go from 0 to 100 overnight. There's a process, and if you don't have a physician that understands that process, it's a physician, it's a therapist, it's a trainer, it's your coach. Everybody needs to be on the same page, or you're going to have a re-injury, continue to have re-injuries. And unfortunately, that's what's happened to him, and he's now this is October, we're now in May, so that's 7 months, over 7 months of a delay of an injury that should have been taken care of. I can go hindsight and be Monday morning quarterback, but definitely should not have been a 7-month process. But, what we do is we take a step back, we evaluate the patient, we look at where some things might have gone sideways, and we rebuild it. But the point is that with any type of injury, you can't go from 0 to 100. I don't care if I'm injecting your back. I don't care if I'm doing your shoulder. You can't expect us to have a miracle medication that's going to get you back to 100% at work. You have to have common sense and help out. And we will play out that regimen for that. Meaning, we will find a way to get it done. And if I can't, I will go ahead and tell you this are the limitations. This is what we're going to look for as part of, like I say a lot of times, I'm going to get you better. Our goal is 75 to 80%. But again, that other 25 to 50% is really on you. If you're not doing what we're asking and you continue to aggravate it, you can't expect us and you can't expect you to become 100%. The classic thing is when I inject you, I take away all your pain, you go back to your normal routine on Monday. It got you into that discomfort. You cannot get a recovery from it. So some good news and exciting news. Dr. Gordon's been here with us. He's still out with, just because of COVID, because of his risk factors and his comorbidities and multiple medical issues. But we have a new doctor starting, Dr. Michael Bonnet. He's finishing up his fellowship at University of Michigan. Anybody knows me close, I'm a go green, go white guy, but we're balancing my office with a go blue guy. So he'll be joining us here in August, but you're going to start seeing him around the office starting next month. He's going to start helping out, so we're excited about that. And like I said, the office is open. We're seeing everyone. We're taking on new patients. We're encouraging you to watch us on Facebook Live. If I get good feedback, we're actually going to start the radio show again through this format, which is fun because then I can get Dana and some of the therapists and some of our charity people back in, and we'll do it remotely. We're not doing it in our studio, but I think it'll be fun and get people to start calling in, those kind of things. So, we're excited. We're very excited. I hope I'm not boring. I hope I'm entertaining to someone. I wasn't as joking today, but making fun of my sweater, and Jules making me wear this t-shirt today for her favorite color, which I feel is more fuchsia than pink. But everybody knows I love my purple. That's where we're going. So the last questions, and we'll wrap it up, is what's my favorite sport to watch or play? Right now, like I talked about, I'm trying to stay active. I'm trying to keep my 13-year-old son interested. And, he plays lacrosse, which is his favorite sport. Actually, we had the conversation this morning that, he thinks it's the best sport ever. It's a combination of everything, and it's fast, it's action, stuff like that. So I'm trying it. I will not get good at it. Pretty much the best sport to watch is probably, obviously college football is big. It's huge, especially when your team, your alumni team is doing well. It's more interesting. Obviously, I have a lot of professional players in hockey and basketball, football, not so much baseball. I enjoy watching that. We enjoy going to all that stuff. But look, I'm a typical guy. I like watching all the sports. I heard, NASCAR's out there. I can appreciate NASCAR. Am I a true fan? I can't say I'm a true fan, but I was fortunate one time I got to go to Indy and I was down in the pits and the rush down there and all the excitement and just the power of those cars. It was amazing. So, I have a lot of stories to tell. I've been fortunate. I've been able to, I was on the ice in Stanley Cup in Pittsburgh. I mean, I was drinking out of the cup. There's a lot of things I've been able to do. It's very fortunate. I've met some of the greats. I got Ted Lindsay on the wall and Gordie Howe on the wall and Nick Lindstrom and all those people. And I was fortunate to be able to be around those individuals for a long period of time. Everybody knows my good friend is George Gervin, and watching The Last Dance with Michael Jordan. It really, like one of the other players said it too. And if anybody saw my Facebook post about my T-shirt, just to give you a little background, I was in Chicago when Michael left for baseball and went back to basketball, but also when he left basketball. So I was in Chicago from '91 to '96 doing my training. So it was said, where were you when Michael returned to baseball? Well, I was on Lakeshore Drive playing volleyball, actually, because I thought I was good, but I was never that good. Gatorade was handing out the T-shirts of Michael's return, Michael Chill's City Sweats. And when that came out, I knew I had it somewhere. So my kids say I never throw anything away. Well, I didn't, because that's from 1994. So it's definitely 6 years older than my oldest child. So I do keep things for a while, but I enjoy sports. I look for it to come back. I know Hardball was on ESPN today and saying that if he has a choice between playing in front of no fans or not playing at all, he would pick playing in front of no fans. So I think it's, there's a lot of obstacles, but there's solutions to every problem that we have. And that's been our motto here at Michigan Sports and Spine. There's always a solution to everything. It's just if you're willing to work through it. So that's my message at the end. I hope you give us positive feedback, because if you do, I'll continue doing this. I think we're having fun with it, and I'm seeing that we actually did get a lot of hellos and shout outs. So there are people out there. I appreciate you chiming in and doing it. It's emotional from here. Peace out.